Last week, the Namibian reported on a mother and her 3 sons' journey with haemophilia, a rare bleeding disorder in which blood doesn't clot normally because it lacks sufficient blood clotting proteins. Individuals with haemophilia may bleed for longer periods of time after an injury than those whose blood clots normally. The bleeding disorder, is mostly unknown to many Namibian people. So today in studio, we have Dr. Landuleni Benjamin, who is the head of pediatrics at the Windhoek Central and Katutura Intermediate Hospitals, as well as the president of the Medical and Dental Council. Also joining us today is Pancho Mulongeni, who is the Namibian's resident epidemiologist, and we'll be discussing and getting an understanding of haemophilia. Dr. Pancho, thank you so much for joining us. So to jump right into it, as I said, haemophilia is an unknown disease to many Namibian people. So, doctor, if you could perhaps briefly describe haemophilia to us and just give us an understanding of what it is.
It's an inherited disorder. In other words, you inherit it, you don't acquire it. Unlike cold and flu, this condition you are often born with. Now, it's an X-link, meaning that it's on the X chromosomes. As you know, males have got an X and a Y. Female have got both two X's. So that one single X, when it's abnormally or is affected, the individual then develop this abnormal clotting. Basically, what it literally means is they bleed a lot longer than normal, but they don't bleed more excessively than you and I.
Okay. So then, Pancho, perhaps you can speak to this. What exactly causes haemophilia?
I'm actually joining you from one of the most famous places for this haemophilia. I'm joining you from London, and as you know, London is the place where the royal family has its seat of power. British royal family, and most famous is Victoria. So Victoria was a famous carrier of the haemophilia mutation. So what exactly causes it? Well, you have two types of haemophilia A and haemophilia B, and in these two types, you have clotting factors A, the A, factor 9, haemophilia B, and you have a mutation, which means that if you think of it as a script, the script to make it clotting factors is slightly changed, and that means the clotting factors are not
Pancho, sorry to interject, but we're having a little bit of difficulty with hearing you. So while the production team just sorts that out for the moment, I'm just going to pass along to the doctor because we can't quite pick up what you're saying. Doctor, I think if you heard, he was talking about the coagulation factors, right? Factor 8 and factor 9.
Yes.
But he was breaking up. So could you please just explain those to us?
Okay. The human body has the ability to do what is called coagulation, which is clotting. But then there has to be a balance between clotting and the removal of those clotting. So you have got two systems. So coagulation cascade or coagulation system versus fibrinogenic, the removal of those clots, because you don't want excessive clotting. So there has to be a balance between the two. Now, the coagulation system or a cascade has got two arms. One of those arms is referred to as an intrinsic. The other arm is referred to as extrinsic. Literally means that they respond to different things within the body. So the extrinsic is usually relying on a tissue factor. The intrinsic is damage to blood vessels as well as exposure of collagen to blood.
Okay.
Now what happens with these two arms, the extrinsic is much faster. Because it's actually shorter. If you were to look at a diagrammatic version of this, you will be able to understand it very easily because one is shorter than the other. Now the intrinsic is much longer and it takes a bit longer. Now the two factors, which is factor 8 and 9, are on the intrinsic pathway.
Okay.
They both would marry at the level where you have got prothromboxane as an enzyme that breaks prothrombin to thrombin. That's where the two will merge.
Okay.
So from there on, it's the same. So now if you look at the intrinsic factor, you have got factor 8, which is often referred to as an anti-hemophiliac factor.
Okay.
It's also a cofactor to factor 9. That's why it's very important. Cofactor 9 activated. Remember, initially they are not activated, but you then have to activate them. Now, in the presence of calcium and phospholipids, which often comes from the platelets, they form a complex, and this complex then activates factor 10 to activated factor 10. And this is the factor that becomes then important, that feeds into what I just described as the cleavage of prothrombin to thrombin.
Okay. So then if there are these, two separate missing factors, right? Factor 8 and factor 9, I'm guessing this influences the type of hemophilia that somebody suffers from. Can you speak to the difference between the two and how the symptoms might look different?
The two are very much the same in terms of presentation. The difference, however, is the type of factor that will be missing. So factor 8 is the commonest. It covers about 85% of our population group for hemophilia. And then factor 9, it's sort of the rare one. And if you look at our statistics in Namibia, we'll also then see how that the numbers of factor 8 much higher than that of factor 9.
Okay.
But in terms of presentation, they both will present with bleeding disorder, basically taking longer, bleeding much longer than normal.
You also mentioned the chromosomes, chromosome X, and I understand that hemophilia is more prevalent in men. Women, though, can also experience hemophilia, although it's a rarity. Can you speak a little bit to the gender dynamics of the hemophiliac experience?
Okay, the majority of our hemophiliacs will be inherited from the mothers. Okay. But they may also be inherited from the father. So let's take the father, for example. So if a hemophiliac father has got a dysfunctional or an X chromosome that has got a problem. So every daughter that he gets will become a carrier. So every single daughter becomes a carrier. Now the sons are not affected because the father is only donating a Y chromosome. He's not donating an X chromosome. Now the reverse is also true. If the mother then is the carrier, so one of those daughters whose father was a hemophiliac become carriers. So when they have children, 50% of their sons will be hemophiliac. The other 50s are normal. Okay. Because they have got two chromosomes, two X chromosomes. So meaning that those who receive the defective ones will become hemophiliac. Those who have the normal one become normal. The daughters, on the other hand, also stand 50%. So 50% will be carrier, 50% will be normal. So that's basically how it happens. But then we must also remember that some of hemophiliac do not have a family history. In other words, it's a sporadic. So no one knows when the mutation took place. So somehow there is a mutation in the genes on that X chromosome again, and now they present as hemophiliacs. Okay.
So that is to say, as you said, it's inherited. It's not something that you can catch. But there can be a mutation that happens that even in a family where there is no history of hemophilia, that somebody can be a hemophiliac.
That's correct. Yes.
So then, most people know literally nothing about this subject area. So what kind of things do people have to look out for them to be able to identify that they are potentially a hemophiliac?
Them depends on at what age they present. The majority of children who present as hemophilia will present at the time when they start to crawl. They start bumping into objects or when they start walking, and that's when you see bruises that you cannot explain. Some of them smaller, some larger. You may also then see them starting to bleed into muscles, and some starts to bleed into joints. Again, the severity, which I will speak to later on, will determine how they present. So it's an issue of severity. So if they are mild, they may just have milder symptoms. The moderate ones may just with minor trauma on, and then obviously the severe ones with absolutely no trauma, spontaneously they may just bleed. So that's the difference. But they often, bruises are probably the first observation on these kids, followed by swelling of joints and perhaps muscles. Some of them, like children, they attend immunization clinics, and you see after immunizations there's swelling, which no one can explain, and then eventually you realize that they're actually bleeding. You'll find a hematoma that you cannot explain, and this is basically bleeding into muscles following a normal vaccination.
And what can the result be if that goes untreated? What would happen to a person? Pancho, you're back with us, so you can also respond to this question. What exactly would happen? Like, what are the results of hemophilia going untreated? Pancho, can you hear me? Seems we're having a little bit of a difficulty with this Zoom link. So, doctor, please do.
Is it better now?
Yes, I can hear you.
Okay, good.
Did you hear the question, Pancho?
Yes, I heard it. What are the consequences? Well, the consequences can be death. Obviously, if the child cannot clot, their wound does not close, they will bleed to death. Other consequences include brain hemorrhage, especially the internal bleeding if the child bumps their head, and even adults. So some of the most famous victims of hemophilia have been European royals. In fact, several of Queen Victoria's grandchildren had hemophilia. The last one that is known to have passed from hemophilia was Infante Alfonso of Spain in 1941.
Okay.
So to bring it back to our current times, we've been told that the European royal families, historically, they would just marry each other. But now that's not longer the case. And why is that? It's not just because they're modernizing, it is because Queen Victoria, who ruled for most and reigned for most of the 19th century, she carried the hemophilia recessive gene in her X chromosome. And because all other European houses wanted to marry into Queen Victoria's house, that means that the hemophilia mutation spread into these other European royal families. The most famous of this, of course, is the heir to the Russian throne, the last heir of the Russian throne. That was Tsarevich Alexei Romanov, who perished in 1917, not because of hemophilia, but because of the Russian Revolution. So what happened was that he had hemophilia. His mother, the Tsarina Alexandra, did not know what to do. She turned to religion and to mysticism, and she found a Russian Orthodox priest known as Rasputin. So this Russian Orthodox priest was able to calm her and calm the child. And also through a series of coincidences where he would predict that the child would survive, and the child actually did survive, he gained a lot of influence. So much so that he actually took control of the government in the second decade of the 20th century. And that led to an increase in revolt against the monarchy in Russia, and was one of the causes of the Russian Revolution, although it was a small cause relative to the fact that Russia was an unequal society and had been so for centuries. Some scholars believe this was one of the tipping point causes that Rasputin took over. He wouldn't have taken over if it wasn't for the fact that the heir to the Russian throne was a hemophiliac, because he was the great-grandson of Queen Victoria.
Okay,
So that is a little bit about...
Okay, so in severe cases, it can lead to fatality. You had mentioned, internal bleeding as well, which would definitely be more difficult to recognize and notice. So what kind of symptoms should people be looking out for, potentially, not the things that we can see, not the external bleeding, but in terms of internal bleeding, if you are a hemophiliac, what kind of things do you need to be watching out for if, say, for example, you bump your head or something?
So for this question, I think the best person to answer would be the medical doctor, because I work with populations, not with patients. Go ahead, doctor.
Okay, yes, please, doctor, do tell us.
Bleeding depends on the side of bleed. So if you bleed in the brain, which is intracerebral bleed, headaches are quite common. So they have these severe headaches, and they may have double vision, or you have other things, dizziness, etc. And they may develop coma to a point of loss of consciousness. So it depends on where you bleed. If you bleed in the abdomen, or what some people just refer as a stomach. So peritoneal bleed, basically bleed into the what is referred to as, in many simple language, stomach. Basically, that space contains solid organs. So and then you have got viscera. So you can bleed from the liver. You can bleed from the pancreas. You can bleed. Spleen, etc. So there are few areas where they can bleed from, and if they bleed a lot from smaller vessels as well, you may see that now all of a sudden the tummy is becoming bigger. They are unstable. They will complain about dizziness, for instance. And if you look at them, they look paper white. You look at their blood pressure. You look at their heart rate, etc. So there are many parameters that you can look at, even if you don't see it like you see a bruise. So there are ways for us to pick up that there is evidence of bleeding in an individual. But the commoner bleeding sites remains the joints and the muscles. Again, it's the larger joints, not the smaller ones. So you look at the shoulder joint, at the level of your arm, just around here, and the knee joint and the ankle joints. And obviously there may be deformity if you bleed in those joints. And if it's in the muscle, remember there will be a pressure effect, because it's a small space. So if you touch it, it's painful. We use the word tender. It's swollen. It may look red, and there may be other evidence of what is often referred to as active inflammation, which is redness, pain, and obviously swelling.
Okay. In the article that the Namibian published last week on this mother and her three sons, the three sons have hemophilia, and she basically was just recounting their experience as a family as the children were growing up. She had mentioned that every time that she had to take the children to the hospital, she found herself in a position of having to explain to doctors that the child is a hemophiliac. Some doctors didn't even quite know what she was saying or what she meant. So in our medical system, if somebody comes in, let's say they go to the emergency room and they're presenting some of these symptoms, is there a course of action that the medical staff know to test for certain things, or do they get? Is there like bracelets? Like some people get these bracelets to say I have A and B disorder. Is there a bracelet that people wear? Do they keep a tag? How exactly does the medical staff know how to approach a situation like that? Say, for example, they don't quite know for sure that the person is a hemophiliac, but they're presenting signs.
I relate very well to what she narrated, particularly because I've seen the same patient referred to us under such circumstances where a mother was very clear of what a child has, and unfortunately the medical staff do not understand. So lack of knowledge and information is the biggest problem we have. And that's why we use every opportunity we get to educate people. I think we have spoken about this condition quite a number of times. Personally, I've been to MBC and few other. And the hemophiliac, under the current leadership, the Voice have done their part to educate many people about the plight of hemophiliac and helping people to understand the condition. I do give talks to medical interns and medical officers at Katutura, and we intend to try to visit more other hospitals to try and educate, because the unfortunate thing is that individuals within our health system do not understand the condition at all. And often when they are told a condition they don't understand, there is that uneasiness. The individuals seem to be quite unhappy about being told something they do not know, and often they become very defensive, and sometimes unnecessarily, to a point of suggesting that the individual must leave because they seem to know more than the doctor, and that's quite unfortunate, to be honest with you. So we have had unfortunate incidents, and I'm not going to discuss them in this forum, but the idea is bracelets or medical alerts are the best.
Okay.
Unfortunately, we should probably start working on them so that many of them do have them, and that will be the first recognition. It's an emergency, so every individual that we see who is bleeding and is a hemophiliac must get treatment as soon as possible. In the absence of factor, there are few things that one can give. There's something called cryotherapy, plasma, which is frozen plasma, or dry plasma. So there are few things that you can give to buy at least time